With this morning is a guy I have a lot of respect for. Joe Schnetzka is an insurance man. He's been in this industry for a long time. And he's also been doing a lot of work on Obamacare in terms of understanding it. I think like the rest of us are trying to. He's got a little different place he can go, though. He's got all kinds of courses and things like that. And he joins us here on the Morning News. Joe, good morning. Welcome to the show.
Good morning, Gary. Glad to be with you.
Joe, I was reading a piece last night. Well, first of all, I heard the new numbers last night. They said about 2.2 million people have signed up. Now, signed up, we were talking this morning, I think I heard Charles Krauthammer say last night, signed up means like you're going to Amazon to buy a book over the internet and you put it in your basket, but you don't pay for it yet. That's kind of where the sign-up is right now. Nobody knows what the numbers are in terms of who's paying for it. 24% of the numbers thus far are from the 18 to 34-year-old range. 78% are coming from people who are getting subsidies or the older part of the population who might be sick, who might have already gotten in there because of pre-existing conditions, which means that they're probably somewhere along the line, if that trend continues, is going to have to be a bailout for the insurance companies down the line, right?
Right. I call this Obama's Mutual Mystification Act because nobody on either side knows what's going on at this point. So it's kind of scary, I think.
I read a piece last night by a guy named Jeff Anderson, and I wanted to ask you if you've come across this. It turns out that there's a third choice right now. There's policy experts out there, a guy named Sean Parnell and Timothy Jost, have noted there's a loophole in the law that could attract millions of young adults and others as well who seek inexpensive insurance. This third way is called short-term health insurance, could provide an affordable, low-risk escape route from Obamacare in the vast majority of states. Americans can secure health insurance for a term of up to 11 months, usually up to 364 days, which is more than enough time to get from one Obamacare open enrollment period to the next. And short-term insurance wasn't generally a very attractive option pre-Obamacare. That's because it provided coverage only during a finite time. But if you contracted a serious illness, any treatment for that condition would be covered only until the policy term ended. But now, with pre-existing conditions in there, you could sign up for an Obamacare program anytime you wanted. Talk a little bit about what short-term insurance is and why it might be more attractive now than it was before.
Well, previously, you always had the short-term insurance. I mean, you always used that when somebody, was going from one job to the other job, knew they weren't going to have any coverage maybe for 90 or 120 days, and so you get the short-term insurance. Thing they have to remember, though, it didn't take care of a lot of pre-existing conditions. Now that pre-existing condition clause is going to be thrown out. It's still only going to buy you time.
Right.
Before the end of the year, I had a number of young ladies that wanted to get on to some type of a health care plan before Obamacare set in, so we went through it. They were all in good health because they did have a pre-existing condition clause in there, so they had to qualify for it. And 23 years old was about $150 a month. It had a $500 deductible.
Right.
90-10, no maternity, but full prescription, that type of thing. Doctor visits and that were paid for. Went in to apply for Obamacare, the same situation. Now, this one gal only made about $18,000 a year at her job, so she qualified for a plan at about $310 a month, got $105 or $110 subsidy, and her premium was, $105 subsidy. Her premium wound up to be $200, $50 more, but the deduction on it was $5,000. So she said, well, this is crazy. She said, I'm paying more, and I'm going to have a higher deductible. So what we did is we got her in under the wire. She's going to have to requalify because that program only lasts till the end of next year. And I guess what a lot of people are trying to figure out is maybe this Obamacare situation will clear itself out and kick out. I know I have right now a lot of people that I need to talk about health care, and they do not qualify for this subsidy. If you qualify for a subsidy, you go through the Affordable Care Act. If you do not qualify for a subsidy, you go outside the Affordable Care Act under the individual policies through some of these areas, but they're still under the guidelines. So the premiums are going to be higher, the deductibles are going to be higher, but they're going to be with companies like Blue Cross, Blue Shield, Highmark, Aetna, and those type. They're going to provide these policies under the auspices of the guidelines of ACA. And, it's crazy. I had a friend that's in this business, and he was 49 years old. His wife's 49. He was paying $750 a month for a $3,500 deductible.
Right.
And then after that, it was $90.10 for the next so little bit. And then after that, they paid a whole lot. He had to go into Obamacare at $1,700 a month for the $5,000 deductible for both of them.
My gosh.
So he's not paying $24,000, $26,000. These people are out of their mind. And, of course, he said, I'll probably just forget this, and I'll just pay the penalty. But, of course, the penalty is 1% of your income. Everybody thinks it's $90 or $95.
Right.
So a lot of the young people that I've been talking to say maybe what we need to do is you need to do a 2 or 3-fold thing. This thing is going to cost you money. It's going to cost everybody money. So maybe you better put your own plan together. Go on to Obamacare, get yourself a high deductible plan, start putting some money back in your own type of health savings account. You may never use your Obama plan, but if you don't sign up for it, you're going to pay a 1% penalty of your wages. There's no way of getting around this. People are going to pay, and are going to pay through the nose compared to what they used to do. The whole philosophy is the people in Washington think everybody should pay through the nose. And there's a lot of people on Social Security, and they have Medicare supplements. I probably have 1,200 clients in that area, and we do a lot of that business every year, and I go out and counsel them as to what's best. Is it a Medicare supplement? Is it an Advantage plan? You have to have a prescription plan. And when they came out with a prescription plan years ago, the government set the guidelines, and then they got out of the way, and they let all the commercial companies bargain for the chips, if you will.
Right.
So there's all kinds of plans out there you can choose from, but at least you have the choice of making it. Now, the government did say if you're 65 and over, you have to have a prescription plan. If you don't, we're going to charge you a 1% a month penalty for every month that you don't have it. So if you're 65 and you don't get prescription drug care, and by 70 you get really sick and you need prescriptions, we'll let you buy in. But if you've been out of the program for 5 years, it's 1% a month, which is 12 months a year, times 5 is 60%. So when you buy in, if the premium's $30, you're going to pay $30 plus 60% of that 30, or an extra $18 a month for the rest of your life.
Wow.
However, you've saved a lot of money by not having it. So there's a couple of different options. And I'm really thinking what's going to happen, there's going to be some options come out. And the one thing you got to be careful of, there's a lot of programs out there, and when you have people selling things, they'll sell things to say, hey, this is great, this is the best thing you can do. And then, of course, they walk away. You have something that maybe may not take care of your situation, but they've walked away with a commission. So I'm not saying our industry is crooked. I'm telling you, this is life. I don't care if it's selling cars or selling insurance or what have you. What we always try to do is sit, talk to the people, find out what they need, give them a couple different options so that they fully understand the plan, and let them make the decision on what they want to buy. There's programs out there like critical illness that you can go out and buy a plan. You can go out and buy a cancer policy and all that type of thing. But you got to remember that you still have to qualify for those plans medically, because they don't come under the Obamacare Act or the Pre-Existing Condition Act. Only plans that are considered credible coverage, if you will,
right,
by the Obamacare Act are going to be the ones that have no pre-existing conditions on.
Yeah, those short-term plans I was talking about, I guess they are free from the community rating, so to speak, and the essential health benefits.
Right.
But I was looking, we heard a lot last night about young people and the 18 to 34-year-old crowd and what they face. And there was an example given here, and I'll throw it at you very quickly, on the short-term plan. For example, a healthy 26-year-old guy, in this case from Milwaukee, was earning $35,000. Now, according to a recent study of Obamacare's premium and subsidies completed by the 2017 project, he could purchase the cheapest bronze-level Obamacare plan, which has a $6,300 deductible for $2,343 a year. Now, he wouldn't receive a taxpayer-funded subsidy, or he could select a 364-day short-term plan with a $5,000 deductible for only $759 annually. Even after paying his $253 fine, that 1% you were talking about, for violating Obamacare's individual mandate, short-term insurance isn't Obamacare approved, he'd be paying only $1,012, a savings of $1,331 versus Obamacare's cheapest bronze plan there at the $2,343 a year. How do you react to that when you hear those kind of numbers?
Well, I'm telling you, yeah, that's available. The only thing I say to everybody, it's either pay me now or pay me later. If you think for a long period of time they're going to allow that to go on when they need all the monetary deductions coming in to Obamacare, you got to be kidding. Because what they're going to do is they're going to go and fine tune this stuff, just like they keep trying to make some steps. I mean, yesterday I think they fired CGI, the federal program, which is I somehow tied into Michelle's classmate, and now they got Accenture, which is a global consulting firm, and they've cut a $90 million contract with them. Then yesterday the House goes and passes a bill that the government has to notify Americans within 2 business days if their personal information was breached by Obamacare. Well, that's okay. So they pass that in the House. It goes over. It sits in the Senate. They keep making these steps to fix this thing, but what they really need to do is sit down and put a real good program together. The seniors, which I mentioned before, and of course he keeps saying, "Oh, this isn't going to affect anybody but Medicare." Well, if you looked at $700 or $800 million are taken out of Medicare, where they're really going to find out in the next couple of years, I really think Medicare premiums are going to go up between 8 and 11% every year for seniors. Or if you go over to one of the Advantage plans where you think that you're getting a lower monthly premium, you are, but now the maximum out of pocket over there is $6,700, and when they keep lowering that capitation fee, that's the amount that the government pays to these private concerns to take these people off the normal Medicare roll. Instead, they were paying them like $800 a month, and over the period of years, it was supposed to go up to $1,000, but under Obamacare, it's going down to $100 over 8 or 9 years. What do you think these companies are going to do when they get less money from the government, and they're going to say, "Well, your premium's higher, your co-pays are higher." Max, it's a boondoggle, and there's a way to fix this. There was a way to fix this before. We had so many millions of Americans uninsured, which they still weren't. They were uninsured because they didn't have a card, but they went into the emergency rooms and they got paid for, and who paid for it? The government. It's going to come right back around. Any system they put in, the government's still going to pay for it. This could have been done different. This was a pure takeover of what is 1/6 of our economy, and that's what this is all about. This is a complete control situation, and I really believe what they want is a single-payer system in the end, that they would just put everybody in Medicaid, Medicare, and we all pay in, and they jack the prices up, and then the government has a whole control of. So I think I really believe that's where it's headed, unless we can get some other people in there to sit down and make some decisions and change this thing in midstream.
And about 1 minute left on this side of the break, but one of the things I heard people talking about last night is you're going to have a bailout. If you don't have the amount of money coming in, if 78% of the people that are signing up are people who are getting subsidies and people who are already ill and people who haven't had health care for the first time, the receivers there are not going to fund the program. It's just not going to work like that, is it?
And that's a scary thing. I tell a lot of the people that I counsel, not only in the insurance but the investments and that type of thing we do. It's if your outgo exceeds your income, your upkeep is going to be your downfall. And you just apply that to the American government right now. And one of the other things I'll just touch on real quickly, they keep talking about these job numbers at 6.7%, yet half of the American public's not working.
Right.
Now let's go back and talk about Social Security. What funds Social Security? Years ago, it used to be 6-to-1 paying in. Now it's 2 or 3-to-1. Well, now we don't even have people working. So if you really want to fix Social Security, if you want to fix all the ills in this country, including health care, get people back to work, give people some kind of an opportunity they can look forward to, you're going to change their attitude and people are going to feel better about themselves.
Joe, we're going to come back and get a final word from you on this. Just take a quick break. Joe Schnetzka with us here this morning in the insurance business and talking a little bit about Obamacare. We'll also hear from Kathleen Sebelius when we come back on something she had to say the other day and get Joe's reaction to that.
We have more than 3 million young adults who have already gained coverage because the Affordable Care Act allows them to stay on their parents' plan until their 26th birthday. So if you're keeping score at home, that adds up to more than 9 million of our fellow Americans who have the security and peace of mind of health insurance as 2014 begins. The numbers show that there is a very strong national demand for affordable health care made possible by the Affordable Care Act. More than 6 million Americans have now either signed up for private health insurance plans or for Medicaid coverage through the marketplace.
And that was Kathleen Sebelius, Health Human Services Secretary. Joe Schnetzka with us this morning from the insurance business. And Joe, how do you react to that?
Well, Gary, I've said for years, in any relationship, whether it's husband and wife, friendship, government, or whatever, you have to be honest, and you have to have trustworthiness. And when that's broken, it takes a long time to get it back. And I just say, here's a lady that pled the Fifth Amendment, I think, when she was asked a lot of questions. And lies, figures, and figures lie. You can take figures and twist them any way you want. And that's how I look at that.
Right.
We're talking about putting children at age 26 on their parents' policies. Well, are they giving anything up for that? Are they going to school? Are they going to a trade school? Are they working? Or are they just sitting around collecting unemployment? That's a whole other discussion.
Absolutely.
Some lady told me the other day, well, we paid for that. And I said, did you really? What did you pay for it? She said, what do you mean? I said, what did you pay for it? What did you pay off your check? What did your employer pay off the check? How many years have you been working? How much money's been collected? How much of your money did you pull out? How much the total thing has been pulled? All that money's been pulled out. It's just one more government bill. It just is a revolving door, and we just keep putting more and more money into it. Well, years ago, or even a couple years ago, I could take somebody who's 20, 21 years old and sell them a policy for $68 a month. It was a $500 deductible. So that they could get it back then, but you know what? Most of them didn't want to because it cost them something. So now you're going to give it to them. They've made a bigger deal out of them having health insurance than the young people did themselves. All you got to do is go out today. Most of them don't have it. When they're mandated to have it, they're not going to do it if they have a choice to make. So when you give somebody something, instead of making them earn it, in some ways, and there's some situations they should. There's some children out there, 21, 22, that have some medical or mental, physical. They should be covered. I mean, we need to have a safety net in this country, but we've lost our way as far as earning things and being responsible for ourselves. I mean, the government's set every program up right now to give you. And I'm afraid that, and that's the other thing. I was talking about to somebody the other day about the roads. And, the gas prices are going to go up. Hey, our roads are crumbling. We got to take care of our roads. We've put this off for a long time. People are willing to pay more taxes if they finally find out that somebody stops squandering all the money. If they would only stop squandering the money, have some honesty and decency and work some programs out, things are going to continually go up. People are willing to pay more taxes because things do get more expensive. But people are getting mad. They're mad because they keep paying more out. And what the money is supposed to be targeted to, it doesn't get there. The things aren't done, and they just squander more money, and then they come out and they rig the figures again. 6 million. I don't want to hear that. Well, and because if they're on their parents' plan, who's paying the premium?
Right, and we get the numbers last night, 2.2 million out there. You say, okay, what's that mean? Well, it really doesn't mean anything until you find out, did the money change hands? Are the policies procured? Have they been paid for? I mean, where is that number? And that number seems to be very elusive. We haven't heard that number yet, nor do I think we will hear it for a little bit of a while from now. But that, to me, the government's job is to make things open and transparent. I remember when our president said this would be the most open and transparent presidency ever. Well, it's been anything but, and especially on this, which affects just so many people in the country. It's just a crime.
Can you imagine how much time, money, and effort we have wasted in the last 5.5 years, whatever it is, since this administration's been in? If we'd had transparency, we wouldn't have all the committees, we wouldn't have this, this is nothing but a big marketing scheme from day one, as far as I'm concerned, to get what they want. They're not up there. They think this is a monopoly game, and we're the little pieces, and they roll the dice, and they move us around. If you pass go, you collect 200. Some do, some don't. Some hit luxury tax. This is a game to these folks, because what they're all doing is sitting there getting wealthy. They're not going to be affected by this. Yeah. They're not affected by the health care. They're not affected by the same systems that we have, and they'll sit there and get their money, and they'll go to their parties, and we're this and we're that, while all the people that are out here that they're supposed to be representing, they're not representing us.
And they'll give exemptions to the friends and make sure the unions are taken care of and all that kind of stuff. So, Joe, it's been great having you aboard this morning. Totally appreciate it. Looking forward to it from time to time, just getting updated on this. And I know you're getting updated on Obamacare and can give us some of the inside stuff. So thank you again for joining us today. Truly appreciate it.
Well, I appreciate that. I'm things change every day, so who knows where we're going.
We got it. Joe, thanks so much. Take care. Joe Schnetzka with us here this morning on the morning news, on the Gary Sutton Show. There, I did it again. I'm going to make that mistake a few times. Darn it, it just flows off my tongue. When we come back, it's going to be your turn to make the call here for the next hour. And I want to know more about Benghazi. Why doesn't Benghazi get the kind of news coverage? Well, we know why, but do we get to a point of ridiculousness where if you don't cover this, you're not really covering the truth in this country? We're going to come back, and if you heard my stuff about Benghazi this morning, the new pages, comment on that or whatever's on your mind. WSBA News Time, 11 o'clock.